Here with me is Professor Anand Anandalingam. He's the Dean of the Business School here at Imperial College. Welcome, Professor Anandalingam. Today I'd like to talk to you about global health and healthcare innovation and the role of IGHI in the Business School. In your opinion, what are the main challenges facing global health today?
I would say there are perhaps three major challenges. The first one is health inequality within nations as well as internationally. So to give you an example, I'm actually from Washington, D.C. And, if you cross a river that runs through Washington, D.C. called the Anacostia River and go to southeast Washington, you'll find both the quality and the quantity of healthcare is much, much worse than in the northwest where I live. So within countries, there is a huge disparity in healthcare. Certainly, if you look at it internationally, the difference in healthcare between, say, a place like Africa and Europe is really great. So health inequality is one of the big issues. Of course, the second issue is that there's an alarming increase in non-communicable diseases. It's a surprise to people. They thought that a lot of these diseases were under control, but seems like that's changing, and that's a big issue. And of course, the third issue that affects Europe in particular, and also places like China, is the aging population. So these are three major issues that the healthcare world has to take care of.
Why is it important to take a multidisciplinary approach to global healthcare needs?
People used to think that all you needed was advances in medicine and that you can take care of a lot of the issues in healthcare. But really, what you need is the interface of medicine with engineering and also medicine with business. And I can give you a couple of examples. It used to be that if you lived in a place like rural India and you got a really bad disease, that you had to travel long distances to go to the nearest major hospital to really have your problem taken care of. A lot of the rural poor didn't have the resources or the time to really travel miles and miles to be taken care of. So what has happened is companies like GE have come up with technology that can be carried to the people as opposed to the people coming to the hospital. And that has led to advances certainly in rural healthcare, but it also has led to advances in the urban rich. A simple example are these miniaturized ultrasounds. You can now carry them to the rural villages miles away from a major hospital and do diagnosis and in fact even cure some of the diseases, because you've decided that there has to be something in the interface of engineering and medicine as opposed to just medicine. Take business. There were lots of companies and well-meaning foundations that decided that immunization was an important thing, and they created all these vaccines that they were going to send to all sorts of parts of the world. But a lot of that was ineffective until they realized they really needed a really good supply chain. Use business principles, create a supply chain using business principles, and lo and behold, the effectiveness of their vaccine campaigns became much better. So I really think you need a multidisciplinary approach to healthcare. That's the only way you're going to be able to solve these problems.
What value does the Institute bring to the Business School and Imperial College?
The IGHI brings an enormous amount of value to both the Business School and Imperial College. The mere existence of IGHI has enabled the Business School to think innovatively about what they offer in the area of healthcare. So right now we have a MSc program in International Healthcare Management that's aimed at really helping healthcare professionals learn how to really come up with innovative ideas in managing the entire healthcare system, both in the United Kingdom, the NHS, but also globally all over the world. The IGHI has also really been the impetus for having entrepreneurship competition. We call it the Student Challenges competition, and that's being done annually to enable our students to think entrepreneurially and innovatively about coming up with solutions to the healthcare crisis. So I think IGHI certainly has been a catalyst for the business school doing lots of new things.
Innovation is at the heart of the Institute. Why do you think innovation in healthcare is important, and how can IGHI and the business school collaborate to innovate?
Yeah, certainly innovation in healthcare is very important, and IGHI, as I said, has been the catalyst for that. already we have the IGHI collaborating with the Royal College of Art in the new Helix Center for Design in Healthcare. The business school is about to launch a new center on healthcare economics and management, which is also going to be thinking innovatively about the healthcare area in collaboration with IGHI. I also talked to you about the Student Challenges competition. That's going to be another place where innovation is going to be spawned by IGHI and the business school working together. But more importantly, I think, really the way to solve the healthcare crisis all over the world, both nationally and internationally, is to find innovative business solutions as much as innovative engineering solutions, as much as innovative medical solutions to tackle these kinds of problems. So certainly innovation in the business school is going to be done in collaboration with IGHI.